encased in bone. Wait a minute. Does that make anybody think about anything with a spinal nerve?
They are in and out both. So they're encased and they're. I never thought that.
It's there to let you know if the spinal cord is being compromised.
Because what?
Because you can feel pain if something's happening to it.
And these things that are exiting, okay, they're going to have their own protection, that myelin sheath, that lipid stuff, okay? But these have to go and service all these areas of my body. I got to have these nerves come out, branch around, and meet the tip of my finger, the tip of my toes, the tip of my nose. That comes to cranial nerves. But anyway, you get the drift, right? Okay? And then, if for some reason something might happen and this kind of scrunches on each other, and we kind of get something compressed, okay, usually that means that area of the body that it services hurts. And then it lets me know that if something out here got done, that I got something breaching my integumentary system, which is my first line of defense, okay, and it might hurt. Okay, so these nerves have to leave, all right? They have to go meet all these areas of the body. They have their own protection, but it's not bone. So once again, looking at some of this that I've already mentioned, we have the grooves and the lines that are existing. They are on both the anterior, posterior sides. We have an anterior median, meaning middle, okay, and a posterior median, which would show on the back. Already mentioned, it's divided, cervical, thoracic, lumbar, sacral, coccygeal. Then, on this cord, if you look, there are going to be areas that look like they bulged because we have to serve the upper limbs and we have to serve the lower limbs. So these are termed enlargements: cervical, upper limb, lumbar, lower limbs. Remember I showed that it kind of comes to a point, okay? They call that a cone, okay? Think about an ice cream cone, okay? And that one is the conus medullaris, where we begin to see it taper at that point. That remaining part that I've pointed out a couple of times, the stuff that looks like the strings, the cauda equina. What does equine mean? Horse. Cauda, do you remember that in regions? The tail. Because it looks like a horse's tail. If you come up and look at it, you know how the horse's tail is just a freaking straight people. Looks like the horse's tail. So, a lot going on there. Quite a bit. Ever thought about it? I bet you will now. I bet y'all will think about it a lot. This is showing how these nerves, okay, these spinal nerves are going to exit and giving us an idea of what I was trying to show earlier about a segment. in looking at this picture, what do you notice about each segment leading up to that spinal nerve? Note, there's only one spinal nerve that exits. But what leads up to that one nerve exiting?
So rootlets.
Rootlets! We need a soft drink named that. Wouldn't that be cool? Rootlets? Make it like candy flavor? Grape and orange and cherry and oh, think about it. These little pieces that are leading up to it, to that one spinal nerve. These get important, okay? And you're probably thinking, why is she spending so much time on this? Can you think of a reason why I want you to understand?
That's important.
Because it controls most of the brain.
Everything. And these are the two, this is one of the two systems that controls the body. So that means all this information has got to go this way. And then every single effect we get, it's got to come this way. So think about this. We have to have information go in and information come out. But I only have one spinal nerve coming out of each side. How is that going to happen? How is that going to serve all these cells in one body? Does that make sense? But it does. So, note that in the structure that we have, the spinal nerves that are going to exit, the rootlets that are going to be present for each section. We also have protective wrapping around this tissue, and these are the meninges. I'm sure you guys have heard of those, right? Because of like meningitis, for example, okay? These are the meninges. They are the connective tissue wrapping. And if you, even though I know it's hard to see, like, you know, that far back, and of course I didn't print the stuff in color, but the meninges, not only are they wrapped at the level of these nerves, it's wrapping towards this inside of the vertebral column, okay? And meninges are going to also be found in and around the brain tissue. So those meninges, like I said, connective tissue membranes. And what does that term fibrous tell us? If you think back to part 1, you should have learned that there are some fibers that exist in the body, and they help make up some of the tissues of the body. For example, collagen fibers, reticular fibers, elastic fibers. So this is letting us know that it is a fibrous membrane. And if you remember about fibers, that lets us know it's tough. Okay? That this is a fibrous structure. And like I just mentioned, it's going to be around this spinal cord nerves running along the vertebra, but we're going to also find that it's in and around the brain, okay, the meninges. What they're doing, yes, separating the soft tissue, because the tissue of the nervous system is soft. The brain is squishy. The spinal cord and spinal nerves, believe it or not, are tough. Okay? If you've ever seen an exposed nerve, I mean, you can literally take like the tweezers or poker, I'm going to say pokers, but and whatever kind of tool you've got, and you can literally go, okay, because it's tough, all right, because it's the fibers, it's that axon portion, okay, and so is the cord itself. It's good, that's good though, because that makes it difficult to damage. What happens if a part of this cord is damaged? Do you see it in any of your like patients that might present?
Yeah, something like maybe they lose function to whatever area those nerves affected.
Exactly. If there's damage that occurs at an area of this spinal cord, it damages all those tissues that it innervates. So people who may have spinal cord injuries, all right, it took something very rough to cause that damage. Okay? Like maybe it was the car wreck. Okay? It took something that jarred this very difficultly, which I know is not technically a term, but you know what I mean, right? Okay? And in doing that, okay, depending upon the severity of it, it could be affecting just a certain area, or it could be affecting everything below it. Paralyzed, for example. Okay? So, even though these fibers are very delicate, at the same time, they're really kind of tough. So, separating the soft tissue, think about the brain, okay, which we'll get to. In the structure of these meninges, there are 3 wrappings. Now, if you remember anything from part 1, how many wrappings were around the muscles?
3.
3. Okay? How many were around the nerves?
Also 3.
3? Okay? Once again, that doesn't change here. We have 3 layers, all right? They have really cool names, all right? Somebody was inventive in lab that day, all right? The outermost layer is called dura, mater, M-A-T-E-R, and that means tough mother. I did not make that up. Okay, that came from lab that day. We have the middle layer, which is called arachnoid, spider. What? Don't worry, we're going to learn why. The inner layer, which will run with any crevices, grooves, sulci, indentations, projections, whatever the case, it will run directly with the tissue itself, and that's the pia, which means delicate. All right? So, for this structure that has gotten created,